Thank you so much. Mr. Chairman and Subcommittee, I appreciate you giving me the time. I'm Dr. Elizabeth Mack. I'm a pediatric critical care physician here in South Carolina, a former high school athlete, a native South Carolinian, and an American Academy of Pediatrics spokesperson. I'm here today to testify against H3477 through the lens of child health. The American Academy of Pediatrics supports pediatricians to have a role for advocating for, educating, and developing liaison relationships with school districts and other community organizations to promote acceptance and inclusion of all children without fear of harassment, exclusion, or bullying because of gender expression, and that pediatricians would have a role in advocating for policies and laws that protect youth who identify as transgender from discrimination and violence. This bill says to our trans youth, not just to those interested in sports, a population already struggling through this pandemic, we do not support you. I have seen far too many suicide attempts and completions in my career, but even more so in the last year and in the LGBTQIA+ population who is particularly at risk. This pandemic has laid bare the inequities in our society, and I think we can all agree our youth are our future. How would we support this? Would we require all children to undergo a detailed examination of their genitals, order their chromosomes? These are not part of the standard pre-participation sports physical. And in fact, the American Academy of Pediatrics pre-participation physical form asks for sex assigned at birth as well as gender identity. How about children whose congenital anatomy or chromosomes are not what the lay public would consider as biological male or female? And would we require children to come out before they're ready? This is an invasion of privacy and developmentally devastating. If patients so choose, hormone therapy does not confer superhuman strength. And the number of children that this bill would affect through its intention is small, but the message it sends is far-reaching and non-inclusive. We as pediatricians and child health providers support all children and realize the importance of providing a loving, supportive environment. And please join me in supporting all of our children and opposing 3477. Thank you so much for your time and consideration on behalf of South Carolina's children and child health advocates.